Hi, I'm Dr. Verma. My full name is Dr. Prashant Verma, and I come from India 3 months back. I wanted to get trained under a very good teacher and in a very good institute. I met Dr. Hong a couple of years back, and when I saw him operating in a live workshop, it was amazing. I never saw this type of skill in any of the surgeons. Operating in a live workshop and answering and giving every answers to the questions from the audience while he is operating. I inquired about him over the internet, and I came to know that he works at Ida Hospital, which is in Taiwan. I read about Ida Hospital and Kaohsiung and Taiwan people a lot over the internet, and before I went in and talked to him, to Dr. Huang, I made myself convinced that I will definitely get trained under him in Ida Hospital in Taiwan. I went to him and I said, I want to get trained under you, and he was so generous to me, he was so gentle to me that he agreed, and I was put in a waiting list for a fellowship. When I arrived here in Taiwan, I was a bit scared, and I was not knowing the language at all. But I became so comfortable in just a few hours only, because the people out here in Taiwan, they're so good. The people, there is no communication barrier. I was not feeling restricted at all because of the language problem. Wherever I was going, I was taken well care of. Anything I wanted, the people already knew it. I mean, like getting off the bus, getting on the train, they knew it. And when I wanted to ask them something, with the sign language, they can make me comfortable, like I know each and every answers, and there is no communication barrier. Now, when I started training under him at Ida Hospital, Ida Hospital is a big institute. I have been around few countries like Australia, Thailand, Singapore, and India. The setup of Ida Hospital, the infrastructure is huge, and when I saw this institute, I was just amazed. Every type of facilities for patients. The good thing about this hospital, that you people care about patient. And when I started getting trained under him, I realized that it's a structured training. You need to start training, and when you start training under in Ida Hospital under Professor Hong, you see, you have to start training as an observer. So few cases you need to be standing and seeing how he inserts the trocar, how the cameraman holds the camera, and how the assistant is assisting the chief. After observing few cases, you need to get an opportunity to get scrubbed in as in a surgical team with the surgeon, and you see where you learn how he is putting up the trocar, and every basics of laparoscopy to advanced. After the structured training means doing an observership, then holding the camera, putting the trocars in for a few cases, and then coming up to doing some advanced work in laparoscopy in bariatric surgery. It's not like that you come here and you learn. It's from A to Z, and you progress slowly according to your competence, according to your knowledge. I had a lot of questions in my mind before I came in here, and I was just keep on annoying him with a lot of questions about bariatric surgery and metabolic surgery. He was operating and he was just answering. I was feeling that I'm like he's in a workshop and I'm questioning him and he's answering my each and every questions. And what I mean to say, minimal access surgery I learned from him actually. Minimal access surgery is not just skin incisions. I learned from him minimal access surgery is inside the tummy, inside the abdomen or inside the body cavity, where minimal invasive surgery means handling the tissue very gently and as less as you can to cause least trauma to the patient organs. That is minimal access surgery, and I learned from him. I learned from him point to point dissection. I think I have been trained all right, but I need to prove myself when I get back to my country and start performing all the bariatric surgeries and metabolic surgery. Coming to the either hospital, the staff here. The staff here is so gentle. They're so kind to you. Everyone is so caring, and when you come here, it doesn't take too long to know them. They start talking to you, and everyone knows a little bit of English here at the staff, but I see the language barrier is not a communication barrier here. Every facilities here in the staff is excellent.